Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 23rd OET writing and speaking as usual, because last Saturday we had an exam and in which the students were discussed with me about the writing. The writing was quite easy. It was a simple referral letter, and also speaking was most of the speaking topics were familiar topic to them. And regarding the listening was quite okay, but the reading was a bit tough to my students. Like they said, the part B and C was quite tough. Anyhow, hope for the best. So well, let's move on to the topic. So what was the letter and what was the speaking topics? Okay, first we'll discuss about the OET letter. So the letter was a referral letter. As usual, the letter is written by a community nurse to a doctor. Actually, the doctor is like he is a vascular. They are writing the letter to a vascular center. So the doctor is the one going to do a further assessment and management of the patient. Anyhow, we'll move on to the letter in detail. So the date of letter is 8th of Jan 2022. As I mentioned you earlier to all that in my last video itself, like nowadays the date of letter is they are giving only the January date since they have started the letters this year. So just make sure with that. So you are writing the letter, the date is 8th of January 2022. And what about the patient? So let's move on to the case note. So patient name Mr. Paul Shimpton, and his date of birth is 79 years old. Like his age is 79 years old. They have given the date of birth as 30th of January 1943. Regarding his social background, Paul is a retired plumber and he is married, and his wife is suffering with rheumatoid arthritis as well as depression. He is a non-smoker, but he is a social drinker and he drinks 8 to 10 units per week. And also he is interested in play lawn bowls and gardening. Coming to the past medical history, he has high cholesterol and since 2014, and also he has type 2 diabetes mellitus since 2017. He has had hypertension since 2017, and he has had left leg ulcer and ankle brachial pressure, which is treated with compression therapy since 2019. Regarding his medication history, he is on Simvastatin 20 mg OD, metformin 500 mg TDS, and amlodipine 5 mg OD, and also he is taking Brufen SPR and Vicas whenever necessary. So now coming to the main present medical history of your patient. Actually, this patient on 1st of January 2022 was diagnosed with pneumonia as he was suffering with shortness of breath. Thereby, he was on antibiotic, in which he has completed 8 days of the antibiotic and remaining 2 days has to be completed. On 8th of 2022 onwards, the community nurse is paying a home visit, which means today. So when the community nurse is paying a home visit, the patient has complained to the nurse during the home visit. What he has complained, which means he has complained of ulcer, but he was not explained this ulcer to the doctor when he gone to the doctor for treating the pneumonia. And this ulcer happened, the onset of the ulcer 6 weeks ago, following a fall, and the ulcer also it spread further areas. On observation, and the nurse came to know that the patient is having below knee bilateral edema, and also it is somewhat looks like either it could be a venous or the atrial ulcer. And thereby they have done the wound swab and they're waiting for the result. And another thing is, like, what is the treatment option for the patient, which means the nurse was doing the dressing with the saline and padding the gauze, and thereby she is writing this letter to the vascular center to a doctor. Her name is Dr. Sonia, for an urgent assessment and treatment. So this is overall letter, which means patient was treated for pneumonia with an antibiotics. That antibiotics course is going to be completed in 2 days. And the community nurse is meantime doing a home visit. While she is doing a home visit, she came to know that that patient is having leg ulcer. And not only the leg ulcer, but also he is having bilateral edema. And also this leg ulcer spreaded other somewhat extended part of the leg. And thereby she done the swab test, and for her it is somewhat looks like atrial or venous, but she is not quite sure with that. And also it could be the reason for atrial insufficiency. So thereby she is writing this letter to a vascular center, Dr. Sonia, for an urgent assessment and treatment. So this is a simple referral letter. Now we are moving to the letter, how we can write an introduction, the body paragraphs and the discharge advice and everything. Okay, so let's move on to it. Introduction. So here the diagnosis they have given, query atrial insufficiency, that is the patient condition. And the purpose is, we are writing this letter to a Dr. Sonia, who is a vascular center doctor. For what purpose? We are requesting this doctor to pay a home visit for the patient for an urgent assessment and treatment. So now how we can make this introduction with the help of these 3 points. So as we know that to make an introduction we need 3 points: patient name, full name, patient condition and purpose, isn't it? So we got this 3 information from the case notes. Now we are going to make an introduction. So this is to request, this letter is to request, we can start like this. This letter is to request a home visit for Mr. Paul Shipton, who is suspected to have atrial insufficiency, full stop. He requires your urgent assessment and a treatment at home. That's it. And now coming to the point of body paragraphs. So body paragraph, the doctor must know how bad the ulcer is and what is the treatment is going on for the patient and what all the past medical condition and what all the medication he is on. About all those things the doctor must know, because we are writing this letter to a doctor. Am I right? So the doctor must know about the medication history, past medical history, present medical history, signs and symptoms, and these all things has to be elaborated as much as possible. Okay, so let's move on to the body paragraph. Mr. Shipton has been under my home visit, because you are the community nurse who is paying a home visit and you are writing this letter to the Dr. Sonia to pay a home visit, isn't it? So which means we can start the body paragraph like this. Mr. Shipton has been under my home visit as per his GP request following a pneumonia treatment, and he is on antibiotic which will be completed in 2 days. Full stop. Now during the visit he has complained of a right leg ulcer. So when you are doing the visit, the patient is complaining of ulcer. So during the visit he has complained of ulcer, and it was started 6 weeks ago following a fall, which was not mentioned to a doctor during the visit. And on assessment, now the patients told about their complaints when you are doing the visit. So now we are doing the assessment. On assessment, the ulcer is spreaded and he was noticed to have below knee bilateral edema. In addition to that, he has granulation at wound bed with moderate amount of hemocerous exudate. Normal sensation and motor lessening were noticed. Therefore, swab was taken from the wound and awaited for the result. And the further thing is, he is suspected to have mixed etiology of venous or atrial ulcer. It could be anything. So this will be the body paragraph, the present medical history. We have to explain it very detailedly what we have noticed from the patient and what patient has explained to us. Okay, now coming to the point of your social background. So Mr. Shipton is retired plumber and married. He is a social drinker and drinks 8 to 10 units per week. Regarding his past medical history, he is on simvastatin 20 mg once daily for high cholesterol, metformin 500 mg 3 times in a day for type 2 diabetes mellitus, and tablet amlodipine 5 mg once daily for hypertension. He is also taking Brufen whenever necessary. Now, upon referral, it would be greatly appreciated if you could visit him at home for further treatment and management. Now, it is important to note that he receives saline dressing with padding gauze. That's it. So the letter is over. So which means introduction, we are just mentioning that we are suspecting because we does not know that either it is atrial or venous, isn't it? So the doctor is the one who has an authority to diagnose the patient. So thereby we are writing who is suspected to have atrial insufficiency. And the purpose is what? She has to pay a home visit for an urgent assessment and treatment of the patient. That's it. Now coming to the point of present medical history paragraph. So what we have to write it over there, he has been under our home visit, isn't it? So during the home visit, he has complained of his ulcer, and also he mentioned to us that I did not mention this to my doctor. And also we are doing an assessment. On the assessment, we came to know that ulcer is somewhat infected and also is spreaded for extended part of the leg, and it is having a bilateral edema. Thereby we have taken a swab and the result is awaiting. And we are just concluding this present medical history like it could be the mixed atrial or venous ulcers, but we are not sure with that. And coming to the social background, he is a married and retired plumber, and he lives with wife and who is having severe or rheumatoid arthritis as well as depression. And also he is a social drinker. He drinks 6 to 10 glasses in a week, and also he is having quite a lot of past medical history, isn't it? This past medical history and all, so what it is exactly causing the patient? So this past medical history and all, which usually cause the patient to have a circulation impairment reasons, isn't it? Because hypertension, high cholesterol, diabetes, these all are the main conditions which will affect the circulation of our body, isn't it? So that's why the patient is suffering with the atrial or venous leg ulcers. So there are highly possibility of the patient to have this because of the past medical history. The patient is having high blood pressure, high cholesterol, and also patient is having like diabetes mellitus, isn't it? So that we have to be explained, and also what medicine patient is taking, that is very important. Then coming to the point of upon referral, what we are doing for the patient so far. So which means we are cleaning that ulcer and with the saline, and we are just covering the ulcer with the gauze piece. And also we are just advising them to advising Dr. Sonia to pay a home visit for the further assessment and treatment of the patient. Okay, so the letter is very simple. If you understand that how the way we can write the story of the patient in the letter formation, so which if we are doing like that, we will able to get past this exam. Okay, and now coming to the point of your speaking topics. So what are the topics? As I said to you earlier, beginning of this video, that I said it was a familiar topics. Yes, of course it was a familiar topics. The topics are like, one is emergency department, in which a patient came up with the complaints of swollen face, which is allergic reaction. So as usual, what kind of treatment we can provide to the patient? Antihistamines, and tell the patient not to use any chemical products, and make sure that what could be the reason for the patient to get swollen face. Either it is a medicine or cosmetic items or the food items that could be the reason for the patient to get this allergic reactions. And these all are the precautionary measures that we are explaining to them, and the treatment option we are explaining to them. And the next topic is pressure sore and aged care center, and the patient suffering with the pressure sores and finger toenail infection, which means a kind of a fungal infection. So for pressure sore, as usual, what is the solution? Positioning and moisturizer, and also proper back care. And the nail things, antifungal creams, and also proper hygienic practice, and trim the nails, and provide the proper toenail cares. That's it. And then coming to the point of the next one is children vaccination, because the baby is traveling with a parent. The parents came up with a query that what kind of the vaccine my baby has to take. Toenail infection, which means a kind of a fungal infection. So for pressure sore, as usual, what is the solution? Positioning and moisturizer, and also proper back care. And the nail things, antifungal creams, and also proper hygienic practice, and trim the nails, and provide the proper toenail cares. That's it. And then coming to the point of the next one is children vaccination, because the baby is traveling with a parent. The parents came up with a query that what kind of the vaccine my baby has to take prior to the travel. So she wants to know more about the importance of the vaccine. So as usual, the benefits of vaccines, and what is the side effects of vaccines, and when they have to take the vaccine. So these all are the advice and education we are giving to the parents. And next thing is cholecystectomy, which means that patient is suffering with cholelithiasis and explaining about a pre-operative and post-operative explanation. So pre-operatively, as we know that nil per oral and the consent, explaining about the patient's psychological support and what is do's and don'ts they have to do it. And post-operatively, antibiotics, analgesics, mobility and wound care management, proper rest, and then regarding the controlling of fast foods. So these all are the things only we are just explaining to the patient. So these all are the familiar topics which we have already come across while we are just training ourselves for the exam, isn't it? So overall the exam was quite okay, and I hope that you all have done in a good way. Whomever gone for their exam, they all have done in a good way. I hope so, and hope for the best result. And the students whomever wants to join in my class, and I have given my number in the description, so you can contact us at any time. You can join in our class. We have 40 days, 50 days, 60 days beginners classes and mock batch, and also we have a crash course, and we have the students who wants only writing modules, speaking modules, listening and reading modules. So these all providing from our academy. It's only an online coaching. So if anyone interested to join in our class, you can contact us and you can join in our class. Okay, so until then, bye bye.